Hello. Sorry, I took a while because I had to, take a breather. But yeah, I think I'm not lying. I'm kind of scared. Like, I don't know. It's weird. It's like, no, I'm just being delusional. I'm just being delusional, big guy. Please tell me I'm just being delusional, big guy. Tell me I'm being delusional. Be delusional. Delusional. Like, honestly, I was thinking about it so deeply last night that I kind of did the whole panic attack. I, what is that? I'm scared. I'm scared, big guy. What is happening? What is happening? I don't want to be part of this narrative. Taylor Swift credits to Taylor Swift. But I don't want to be part of this narrative. They, Taylor. I was gonna say Taylor, but I'm what do you mean? What's in wait, okay, let me watch the music. Now I gotta watch the music video. You can't hear it though. Oh, that's the oh my god, big guy, why are you showing me this shit? I'm alone. I'm alone right now, big guy. Why would you tell? It's locked. Oh my god. What if someone's like fucking actually stalking? Sorry, I'm watching it right now. I don't know if you can see it, but yeah, you can see it, I think. I'm sorry. I'm just really weird today. I'm feeling weird. Oh my god, that's how I feel sometimes in the shower. Now I want to hear it. Somebody's watching. Oh, it's this one. Okay. Yeah, it's crazy. Like I feel like someone's playing tricks on me. Yeah, actually, to think about it, like is someone trying to like, you know, am I calling this out right? Like, first time it's a coincidence, second time it becomes weird, third it becomes weirder, fourth it becomes weirder, five, or maybe this is fucking the CEO doing some sort of shit like, oh, personalization or something. I'm just really scared. I'm just getting scared. It's weird. Maybe I should move to kick. Should move to kick, big guy. Maybe I should. Maybe this is time. And yeah, like I said, I'm taking the spiralactone. Like, oh, actually, speaking of, that's more for heart though. Like, it's more for heart as well. But no, anxiety specific to anxiety. No, not taking anything. But look, I'm shaking. I'm shaking. I'm fucking see, this is what I'm saying. I feel like that's how weird I get sometimes. And actually that happens in public as well. Like whenever I go out, like I get all like shit. Like cuz yeah, I don't I just want to blend in. I think that's the thing back that I cuz my partner keeps saying like why is it weird for you? Hmm, I do. I haven't seen her for a while, but I should. Um, sorry. Sorry. I need to like stay grounded. I need to stay grounded. But yeah. Sometimes. Yeah. Is that weird? Be honest, big guy. Is that a weird thing? Oh my god, it's crazy. I don't know. I just yeah. Cause yeah, I end up just asking. Oh, I don't know. I keep saying the same thing. I don't know. Psychologists don't know better. It's psychiatrists who I need. Like if I'm oh that's true actually if they could like refer me to a psychiatrist. But that's the thing as well. I'm taking antidepressants. So I kind of want to get off that, but I haven't seen my thing yet because I'm not sure if he's living. I'm not sure if he's at Rubina. Wow. Thank you. I will. Does that sound weird? I'm sorry. Did I weird you out? I hope I didn't weird you out. I will see her soon though. I'm just making up the time. And I tried my best to like get better myself. I didn't want to like maybe it is that. That's a good way to like show this like what the song is about, I guess. Like a different perspective on the song. Oh my god, is this gonna be blocked? I hope it's not gonna be blocked. Yeah, the mailman, of course. Fuck the mailman. The ospos here are shit. The visual. Anyway, I've been also finding out this whole I was reading about this I was well I think I should go. Like, see, I found something else again, and now I'm interested. Um, let me like, segregate those really quick. Segregate. No. Ah, I see. We don't say that to Tunch. Shh. Oi, we didn't hear anything. I didn't hear anything about like blocking the visual like YouTube does. Because yeah, YouTube does. So yeah, within Kearns, something happened in Kearns where they had like a surge of people getting this specific case of yeah melioidosis basically. Well, they found, wait, let me see, because I think the study actually showed the amount. Why am I clicking that? They actually showed the data. So they showed uh 8 cases so far. This is from the 8 cases. I think, I'm not sure if, let me see. Let us read just so that tropical infections is caused by they are challenging. Fever sepsis following 7 days of fevers, abdominal pain, and urinary unknown. So yeah, out of the 8 cases that is shown here on the table, I'm not sure if you guys can see it. One, two, three, four. Oh wait, there's previous. So one, two, three, four, five, six. 6 out of 8 of them had no previous cases. And some of them had cases of diabetes, which makes it um severe for them, basically, like much more risky. Um this they took demonstrated outsourcing with the priority condemning. A salmonella infection was initially thought most likely, but on day 3, B. pseudomalae was identified in blood and urine cultures taken at presentation, confirming the diagnosis of melioidosis. This bacteria. This six of his submission. No plan to further operate procedure. He was discharged on lifelong simply. 74-year-old. This is the second case. I think this is the first guy. This is the case one. If you can check. You I think you need to search their names if you wanna look more. But yeah, I was listening to a CDC document. Like I was like read where's that? I was just gonna continue doing that if you don't mind. Um, there is a video. This is this is a video from CDC, but they're kind of explaining how yeah, how specifically to maintain it, like the management basically. And yeah, they use the whole thing as an example. There was a video about it actually from ABC. One of their suspicions are the Bruce Highway project that went through. Um, it's right. The hospital discharge who ultimately died as a result. A high case fatality, contemporary Australian standard. Adverse drug reactions were documented in 4 out of 7 who commenced oral trimethoprim. So, methop says what? Eradication therapy and you like, I'm not sure if they okay oral. So basically like similar to antibiotics but stronger, I think. Um, An additional 2 patients were unable to adhere to their prescribed SMPTMX, one of whom died from relapse. But yeah, yeah, it's they're still like looking into it. I think they wait. I think there's a particular like there's a picture of they were able to contain the bacteria, the what do you call that? The thing? What do you call the thing? I forgot what that's called. Um, what's the whole circle thing that they use when you like do some like science shit, like biology shit, biology, like the swab thing, and they all do that. So they do shit. Oh my god, I forgot. What thing? No, that's not what I mean. That call that. Okay. I gotta search it. I gotta search. Oh, I think it's here. I think it's here. Agar plate. Bitch, bitch, agar plate. Whatever. Anyway, anyway, let's look into this because I'm interested at this shit. This is how I distract myself. But yeah, there's also a map. Um, they also did this map in the I think Philippines. Woo, Philippines, smart Philippines. Um, I didn't read it yet, honestly. Let me check it. Holderia May causing malaria is becoming a major endemic in southeast. Endemic is local, right? Yeah, native. Yeah, it's a native. It's something that belongs there, basically, beyond the established area of endemicity. This study aimed to determine the environmental variables that would predict the most suitable ecological niche for this pathogenic bacterium in Southeast Asia. Philippines. By maximum entropy and modeling, systematic review and meta-analysis of data and meliosis were obtained from public databases, PubMed, the potential map showing the ArcGIS, and the ArcGIS is like a software, and the Max and software, another software, modeling too, so the both bioclimatic and found to be the most important niche determining environmental variables affecting the geographical distribution of the highest probability of and combining this the predicted distribution. PP causes millionites. Okay, do you have where's their map? Placement items for religiosis, info. So yeah, they actually have a website to share awareness about, they have a world map. There we go. So they have a world map where they could show if it's like, okay, so complete absence in lucky country, like lucky states, these ones. But unfortunately they're in, yeah, yeah. So hopefully it stays like some, so it comes from the ground basically. This is what the thing is. It comes from the soil. That's where the bacteria comes from. And so when that Bruce Highway started, um basically the Bruce Highway construction project went through, and that basically like they were, I'm not sure, like that's, I think that's what they need to clarify in terms of like the study. Bruce Highway is a it's a project in Queensland. Basically, it's a infrastructure program that plans to expand the whole um, way from far north Queensland all the way to the metros of Queensland. I'm not sure. Bruce Highway. Let's see. the mm, the Bruce Highway was named after Mr. Henry Adam Burrs, the Queensland Minister for Public Works. So he was like the minister at some point. Like basically when they started the project, which is like the Bruce Highway. So that's the map for Bruce Highway. It connects Cairns all the way to Brisbane. Cause that's a pretty long road, you know. Like like it looks small, but I'm just in a tiny bit. I'm just in a tiny bit of that. So yeah, this is one of the people who got um yeah. So I mean Brisbane. So the moment you connect, I think we go through the Bruce Highway whenever we go past Brucey, which is I mean Sunshine Coast and Noosa. That's how far I've gone so far. But basically sorry, I'm just thinking. Um the further you um the moment that highway stops, you'll meet several, like it becomes an intersection or something. Otherwise it just goes through the M1, which is like the road that connects Gold Coast, oh no, Queensland to New South Wales. Does that make sense? So it's like a corridor. There you go. So basically I'm within the like intersections, different parts of which is actually like, yeah, it's cool because we could just like, we're actually just 50 minutes away or something, 60 an hour in between in between like in between both major airports. Oh no, local and major. So anyway, yeah, he talks about his experience. It took them it's very similar to like, I'm sorry to be inserting myself. in this whole case, but it's very similar to um how my case of like because yeah, I had scholera something like it's called scholera or something, and I had to go through like it's similar to like a tuberculosis. It's based on the bacteria. It's based on the bacteria that causes tuberculosis, but my nodes basically blocked them. They blocked the whole thing. So yeah, since it was blocked, it was able to contaminate itself. Immune system, basically your immune system was my immune system was able to block it, and yeah, it started this huge lump on my fucking neck. I think it's still here. I think there's still a set, like I think it's still visible. But yeah, it grew so big, and it took me a while. Like we were like you go through a GP first, before you do all that shit. And yeah, I was close to like going through like the Gold Coast Hospital because they need to like even like the specialists couldn't figure it out. Like they're looking at it and like hmm, you know. So yeah, and then all of a sudden the department of like a department within I forgot what department it was. I'm thinking about it, sorry. But it was a department, it was department within the Gold Coast, not Gold Coast, Princess Alexandria, I think it's called. Yeah, I had to go through like treatments and all that. And it basically got smaller and smaller. So I think it's yeah, I think that like that process is similar to that. They had to go through like basically a non-stop every day. Similar but different, obviously. So out of I think adverse drug reactions were documented in 4 out of 7 who commenced oral. An additional 2 patients were unable to adhere to their prescribed SME. SMI, one of them died from relapse melioidosis. Mycot Mycotic aneurysm is an infrequent manifest. Ah, okay. That's shit. Oh. The diagnosis should be considered in older patients who reside in or have traveled to endemic areas and where vascular surgery would be targeted. Oh, they made the whole thing. Even in well-resourced healthcare settings with access to advanced critical care support, the case fatality rate can rise to 25%. So it is like deadly like despite the fact that even though you can put as many like hospitals or shit, it's deadly basically. Um cause of invasion of the basin. Okay. Means asymptomatic. 74-year-old woman who had been treated for pulmonary initially believed to have an undiagnosed malignancy. Her first episode of that was followed by 6 months of after SMX. So her risk factors for me included chronic suppression. She's a smoker, but had known vascular disease. Which displayed adjacent structures without invading them and surrounded the aorta without significantly. I think it's aorta like the heart, like main blood vessel heart. No, it's not. The aorta is a large cane-shaped vessel that delivers oxygen-rich blood to your body. Hmm. See, so it's like it's an artery. I see. So right from there, so the heart and then everything else goes all the way down there. Hmm. I see. That's interesting. Anatomy. What is the anatomy? This was confirmed after fine needle aspiration of the mass and blood immune cultures. Yeah, despite 1 week of IV and oral discipline, she remained bacteria met. Okay, bacteria in the blood. Um, so they had to put her on IV as well. So that means they had to put the nutrients on her. And the general surgeons felt that surgery would be too dangerous as the mass was in big vessels. The diagnosis of mycotic aneurysm was not in 1919 IV. Theta was the obtained. It demonstrated a 50% increase in the signs. Blah 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 blah. And I'm sorry, I'm saying blah blah blah. I don't mean like I'm just saying blah 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 to the post. Not her. I'm sorry. I'm sorry. The vascular surgeon successfully performed an open repair of the leaking abdominal. She completed 6 whole genome sequencing of the isolate. Oh, okay. Woo. So she's alive. Thank you so much, doctors. Thank you so much. Computed tomography findings in patients with mycotic aneurysms due to the abdomen in case of demonstrating mycotic aneurysm of the aorta with the inflammation of the vessel wall. Wow, they're like wow, these are I think these are really like I don't know, BCP abdomen in case to demonstrating ruptured mycotic aneurysm of the aorta with associated hematoma. Wow, you don't see the like you need to be really like noticing those sort of shit. That's why like it's interesting to be a doctor in a way, but fuck, I think I'm just gonna watch like Grey's Anatomy. Like fuck. Like sometimes like it feels like oh that's a lot of work. I don't think I could even stream. It would be disrespectful to stream it in front of like streaming in front of your patient while they're like they're expecting that anonymity, like privacy. That's the very important thing as well. Um, let's see. So it's not as clear here. I think they need to show like a better quality. I'm not sure if they show it. They'd show it on their study, but yeah. Panel C, thorax with intravenous contrast in case 5, demonstrating mycotic aneurysm of the thorax. Aorta with mural thrombus, white arrow. So I think thorax is like neck. Is it neck? Let me see, thorax. Yeah. Oh no, it's not. Chest. Oh my god, I got my fucking logo. Yay! Embarrassing. Thorax or chest is the. Okay, so it's in the chest. So that is the chest. On the top. Okay, is it from the top or where is this pictured from? CT thorax with intravenous contrast in case 5 demonstrating myocardial aneurysm and neural thrombus. White arrow. Clinical findings at the time of presentation of the 8 patients. Abdominal pain, constipation, urinary pain, weight loss, and functional decline. Fevers, flank pain, and pneumonia, mycotic aneurysm. Disseminated, blah, blah, blah. Wet season presentation. What is wet season? The wet season in far northeast Queensland region traditionally runs from December 1 to April 30. Documented at admission in the medical record. Case 5 presented on 19 May. Oh, okay. They were able to record like all of the. Okay, that's cool. Oh shit! It's not cool to have the sickness, but like the thing. Um, Case 1, abdominal pain, constipation, urinary tension, weight loss and functional decline, fevers, flank pain, lumbar back pain, lethargy, fevers, internal chest pain, productive cough, sore throat, mycotic aneurysm, fever, dysuria, lower back pain, and hematoma, fevers, back pain, again, urosepsis, malignancy, pneumonia, abdominal aorta, common iliac artery. Abdominal aorta is abdominal. Ah, 10, 20, 40, 12. Oh, shit. I don't know what T. I think T4 to T. Is it talking about the collarbone or something? I'm not sure what it's talking about. Um, Paired visceral branches arising laterally to supply broncho. Most commonly, only the paired left and so it's this bit. Abdominal aorta. As for aorta vertebrae, at this level, the aorta terminates by the left and right common iliac. Oh my god, that is so. Chest, abdominal, iliac artery, large. Hmm. 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 So this is your tummy. Like, I think it's this one. Um. Unpaired. So I think unpaired just one, paired two of them. Okay, yep. Air passage. So this is your okay, I see. So this is showing the system. Oh my god, that is so amazing how our body works, eh? That is so shit. Like it's shit and cool. Shit cool, not bad cool. Like it's like a computer in a way. Aortic aneurysm. Yeah, yeah. I had an uncle. Not an uncle. He was more like a brother actually. He was studying to become a doctor too. That was crazy. That's crazy. He was almost done. He was really almost done. He was studying to be a doctor and he was almost done. And then something happened. And he got an aneurysm. I think it was somewhere in his like head, like one of the vessels in his head. I'm not sure which one, but yeah. Wow. It's asking me about the specific vertebral levels. I see. That's cool. Yeah, I guess I couldn't find anything. It's like a way to like identify which part of the body. Oh, that's really neat. Sorry, we're not supposed to be like looking at that because that is not what I'm supposed to be looking into. Sorry, I'm getting lost sometimes. Like that's how I get lost at this sort of shit. Other sites affected: lung, knee, septic, arthritis, aortic valve, and the lung, prostate, ano, kidney infection, lung, skin, genitourinary system. Oh, okay. So it's the PP or the vagina. Time symptoms to diagnosis: 10, 3, 8, 21, 20, 11, 6, 8, 5. Diagnosis 327 6. Oh wow, that took a while. Looks like he's the I feel like he's the one with the most record, like he has the most consultations, I feel. Because yeah, it showed all of his symptoms like that. Like 3 months. Wow. Crazy. And this one's has sciatica. No documented any single blood cultures were positive. Treatment and clinical course for the 8 patients. Oh shit, I'm supposed to like do some I'm supposed to do laundry. Now I'm kind of shy to like do some laundry because I feel like, you know what, I'm gonna do it anyway. Sorry, I'm doing laundry. I gotta do it. Oh my god, look at my hair. So many hair. I hate my hair sometimes. Sometimes I just want to shave it. Like it's so crazy. Sorry, I'm moving a lot. Sorry. I had to like start the laundry. Youngies, let's read this. Continue reads. ICU admission surgical procedure. Yes, EVAR. Yes. What's EVAR? Oh. Why didn't you tell me? Yeah. Sorry, I'm gonna make that louder for you so that you listen to that song. Because this song is an iconic song. Cardiovascular aneurysm repair. So it's a type of oh oh. You get it now. Self-explanatory diagram. I'm not gonna read that for you. Stent graph. Oh, fudge. I'm not gonna read that. Open repair of mycotic triple A. Oh, I didn't know they got triple A as well. What's triple A? There's no AAA though. What's AAA? Oh, abdominal aortic aneurysm. Oh, okay. No, yes, no. No, left internal coiling. No, open repair, open repair, open repair, duodenal repair, kidney injury. I wanna do it again. Duration of IV antibiotic. Oh, IV antibiotics as well. Oh, or is it just IV? So if they say IV, it's anything that gets injected on your thing. So they, okay, I see. Meropenem 1, GTDS, 9 weeks. Up to time, 2G, quid, QID, PMP, and SMP, SMX, 321,600 milligram. Look at that. That's a large amount. That's a lot. Yeah, it's they're strong. Those are strong medication. Your PP turns your PP, not PP, like the piss, like the liquid piss, the liquid waste. It actually turns out to be really yellow. I'm not sure if it's the case here. Adherent, alive after require desensitization. Ah, alive 3 years, died 2 years and 9 months after presentation. Died 106 days. Oh, so these are the two patients who died. Two cases, sorry. Died 22 days. So this one is the shortest one. I'm not sure if they are like the same in terms of like, yeah, I think they're the same in terms of like the table. So it's the 71 male. Ex-smoker. Wow. Okay, so let's continue reading. Computed tomography, positron emission tomography. Findings in patients with mycotic aneurysms due to history demonstrating avidity at the distal limb of the aortic graft. Panel B, CTPET of abdomen in case 6 demonstrating avidity of the aorta arrow. What's avidity? Hmm? High avidity due to their 10-week binding sites. The purpose of this chapter is to shed light on the strength of interaction neoclies. Okay. I don't need to read that. I think I'm getting lost in where I'm supposed. 74-year-old man presented with 2 days of fever, back pain, weakness, and diarrhea. The risk factor for melioidosis included CKD and hazardous alcohol use. He had established vascular disease, open, having had and typo open a triple A repair 18 years prior, revised 9 years later with a branch in the vascular aneurysm repair or BVAR. He had been treated 2 months earlier at another hospital for pulmonary melioidosis and had a small collection adjacent to the iliac limb of the aortic graft, which had cultured B. pseudomalae. He completed 4 weeks of IV meropenem, and it was intended that he take lifelong oral at the MPSMX due to the proximity of the collection of to the graft. However, the patient was unable to tolerate and he discontinued. Oh, yeah. Oh, I mean, I feel bad. Fudge. He he represented to our hospital. Presented again, basically, to our hospital 3 weeks after completing his meropenem and 11 days after discharge from the other hospital. He was admitted to ICU after confirmed clostridiotes, difficile colitis, acute kidney injury, and although blood cultures were negative, suspected relapse of melioidosis, he received empirical IV meropenem with oral. I'm tired. He received empirical IV meropenem with oral metronidazole and vancomycin. CTAP revealed a left renal infarct, but no evidence of aortic infection. However, CT positron emission tomography or CT PET on day 6 revealed increased uptake at the site of the aortic graft, which is like, I think it's pelvis in case 3, avidity at the distal limb of the aortic graft. I think it's this one. And then that one. Oh. Oh no, this is case 6 actually. Case 3, just that one. Vascular surgeons felt that the patient's significant comorbidity precluded graft removal and he was planned to receive 12 weeks of ceftazidime, ceftazidime via electrometric infuser with subsequent lifelong PMP SMX. 1 week after commencing, he developed a severe achy eye. What's an achy eye? I think it's an acute kidney injury. It's when you lose the ability to filter waste. Acute. Oh my god, this is fucking what my this is how my one of my uncle passed away. He passed away from kidney like basically the kidney failed. It's weird because I remember whenever I think of him, like, oh wow, he was drunk most of the time. He was always drunk. I'm not sure. Is that how alcohol works? Are people like, I don't know, because yeah, there's something back in the Philippines, at least with our culture, where we call it bungar, and it's basically drinking alcohol to like remove the hangover the next day. And whatever they're drinking is like the alcohol, it's gin. It's a specific type of gin. You couldn't get it anywhere other than bringing it. I think I was mentioning it this before, but yeah. I'm sorry. I was suddenly thinking about it now and like yeah, I don't know. Fudge. I'm just going. Okay, let's go back to this one. CTAP revealed their left renal infarct, but no evidence. This necessary readmission but did not ultimately require dialysis. After his renal function improved, he was discharged on lifelong oxytocin. Okay. So now he has to go. Yeah, he agreed basically. So he started yeah. Wow. Oh my god, what am I saying? Wow. Sorry, I shouldn't say wow. Don't say wow, Kirsch. Stop saying wow. Nothing's amazing about that. An 81-year-old man presented to the emergency department with 4 days of back pain, lethargy, and fevers. He had also undergone outpatient bronchoscopy for investigation of a cavitating lung lesion 1 day prior. His medical history included myelofibrosis, dermatitis, for which he regularly took short courses of prednisolone, and peripheral vascular disease. He was treated for pneumonia, but despite IV amoxicillin clavulanic acid, he continued to have fever. Serial blood cultures were taken and grew. The pseudomallay on day 8. CTAP on day 8 showed a 33 millimeter eccentric aneurysm on his left common iliac artery with oh, rounding consistent with a penetrating atherosclerotic ulcer or a mycotic aneurysm. CTPD demonstrated high uptake in the he underwent coiling of the initial. He was treated initially with meropenem discharge on and oral SMPSMF. However, he developed a widespread brush drug reaction to the TMPSMS, which required readmission to hospital. Desensitization was attempted within several hours of exposure. He therefore received 9 weeks of the fudge. Ceftazidime. I'm sorry. Followed by lifelong doxycycline. Given that a presumed stent infection, he died from complications of the myelofibrosis 33 months after his presentation. Rest in peace. A 55-year-old man presented to a rural health facility with 1 week pleuritic chest pain and a productive cough. He had a history. He smoked the Zaza. He had a history of hazardous alcohol use and smoked cigarettes and the Zaza. He had no known vascular disease. He was transferred to a tertiary referral hospital where a CT chest on arrival identified a rupturing pseudoaneurysm of the inferior aortic arc, consistent with a traumatic or mycotic aortology and a cavitating lung lesion. Oh, where? Figure 1. What's the figure? Oh, this one. Oh, okay. Like they're just talking. Like it's just. Why did I click that? I thought it was a picture. He was. He comments on empirical menopyramine transferred to quaternary center on the same day. Peripheral blood cultures flagged gram-negative bacilli 48H and were speciated on day 3 of his admission as pseudomallay. He had a thorax endovascular aortic repair or TVAR and received 8 weeks of ceftazidime and oral TMP SMX with a plan of for lifelong SMP SMX. However, after discharge, he failed to answer multiple telephone calls from health workers, and he represented 5 weeks later. Ay, ay, ay. Endo leak. CT angiogram demonstrated endoleak at the proximal end of his graph and blood cultures again in isolated P. pseudomallate. The vascular surgeons consider proximal extension of the TPAR. However, the patient deteriorated, having an acute myocardial infarction. A coronary angiogram demonstrated critical triple vessel disease with no options for blah 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 blah, revealed a left ventricular ejection fraction of 20%, precluding further vascular surgery. He was managed as an inpatient with ongoing IV antibiotic therapy, but developed shock hypoxia and hemodynamic aneurysm rupture 106 days. 58-year-old man presented. Oh my god, 58-year-old too. That's young. That's still young. 58-year-old man presented with 1 month of fevers and 1 week of back pain, dysuria, and he had a history of asthma, heart disease, was a current smoker and not adhered to his prescribed antiplatelet therapy. A CTAP on admission revealed a juxtarenal aortic aneurysm and a prostatic abscess. Disseminated melioidosis was suspected on day 3. He underwent transferal drainage of the prostatic abscess, bladder washings, and blood culture screw. And the patient had an open repair of the AAA on this. AAA is the acute kidney blah blah blah, acute kidney failure, I think. On day 16, which identified an aortic phlegmon. This was excised and the defect was repaired with a femoral vein patch. Aortic tissue cultured B. pseudomallate, confirming the diagnosis of mycotic aneurysm. He was discharged on day 22 to complete a total of 8 weeks IV ceftazidime. However, 10 weeks after his initial presentation, he returned to hospital myocardial infarction, which was treated with balloon angioplasty. Several hours later, he had an acute upper gastrointestinal bleed, controlled with endoscopic injection of adrenaline and hemostatic clips. 1 day later, he developed acute bowel ischemia, confirmed by laparotomy, which necessitated total information of the following discharge from ICU. He received total disability TMX was planned eradication but developed an AKI. AKI is like the kidney failure. What's triple A then? Oh, it's showing the wrong context. Malay. Is that what it's called? Wait, let me actually check it in the. I think they have a reference somewhere. Abdominal aortic aneurysm. That's it. So it's okay. So the aneurysm. On day 16, which identified. Nope, not that one. Oh, so the 58-year-old man died after. Oh, oh my God. I'm sorry, I sound exaggerated, but no, I'm trying to like. Well, he died suddenly and unexpectedly at home later that night. This was thought most likely to be due to a cardiac event. So I think they weren't able to like, maybe it's out of respect for the family, obviously. I was thinking like, oh, I thought they would open it up for science, you know. I'm sorry, open it up. Rest in peace, rest in peace. Um Discussion. This case series highlights the turbulent clinical course that patients with a there's case 7, sorry. Wait, I'm kind of confused how this is. Oh my God, sorry, I think I read the wrong thing. This is different. Okay, shit. That is so confusing and embarrassing. Aortic tissue cultured beef pseudomallay confirming the diagnosis of mycotic aneurysm. He was discharged on day 22 to complete a total of 8 weeks IV ceftazidime via elastometric infuser. However, 10 weeks after his initial presentation, he returned to hospital with a myocardial infarction, which was treated with balloon angioplasty. Several hours later, he had an acute upper gastrointestinal bleed controlled with endoscopic injection of adrenaline and hemostatic clips. 1 day later, he developed acute bowel ischemia, confirmed by laparotomy, which necessitated total colectomy with formation of an end ileostomy. Following discharge from ICU, he received an oral SMV SMF but developed an AKI and hyper within 2 weeks. This improved upon cessation of TMP and SMX, and doxycycline was well tolerated. It represented several weeks later with a small filing, having small bowel. He had a prolonged hospital admission requiring total parental nutrition for 4 weeks while he convalesced from his multiple surgeries. While he was finally discharged home 5 months, more than 5 months after his first presentation, and remains well in the community 9 months after. Okay, that's good. 55-year-old man was transferred from a rural. This one is the guy who died, actually. This one, the case 7. Oh, no, case 8, actually. Oh my God. I'm sorry. Erase everything I said a while ago. Erase everything. I was getting shocked reading the wrong context of things. Um, I'm not angry. I'm just getting used to that face. A 55-year-old man was transferred from a rural hospital with a diagnosis of cutaneous melioidosis. His only risk factor for melioidosis was hazardous alcohol use. He had presented with 8 weeks of non-healing skin ulcers of his lower abdomen and right shin and 2 weeks of fevers, malaise, and lower back pain after several failed courses of oral antibiotics targeting common skin pathogens. The lesion on his shin was swabbed and cultured by pseudomallay. He had 3 sets of blood cultures. All were negative. He was transferred to a tertiary hospital where a CTAP identified a saccular infrarenal mycotic aneurysm. He underwent an open repair on day 6. Aortic tissue obtained intraoperatively cultured B. pseudomallay. The patient was treated with IV ceftazidime, which was intended to continue for 8 weeks. Unfortunately, on day 10 of his admission, the patient discharged himself against medical advice. He received a supply of SMPT SMX on discharge but reported that he never took this. He presented to his local hospital 6 days later with fevers and received a further 9 days of IV where's that? Ceftazidime, but discharged himself against medical advice again. Further SMPSMX was dispensed, but it is unclear whether he took any tablets. Despite repeated attempts to engage him in care, he failed to attend outpatient follow-up. He represented 3 months later with abdominal pain and low-grade fevers. He was taking doxycycline at the time. He had normal inflammatory markers and was managed as an outpatient. He remains living in the community 7 months after his initial admission. He is not engaged in care but has not required hospital readmission. A 71-year-old woman was referred by his general practitioner with a 7-month history of acute on chronic back pain, weight loss, and malaise. His medical history included previous coronary artery bypass graft. Normal reference range on his initial presentation. He was discharged from the emergency department with diagnosis of sciatica, but was recalled when his urine culture group B pseudomallay at CT of his chest, abdomen, and the pelvis. MRI spine did not reveal a focus of infection. Between PT scan, day 4, suggestive of mycotic aneurysm. I'm getting exhausted reading this shit. Suggested of mycotic aneurysm at the site of his infrarenal AAA. He underwent an open AAA repair on day 6, which demonstrated that the mycotic aneurysm was also impinging on his duodenum. Hmm. Which was therefore also debrided and repaired. He developed acute pulmonary edema on day 15, requiring a short ICU admission. He was discharged on day 22. Okay, so yeah, he died suddenly after. Wow, okay, I see. After like day 15 requiring a short ICU admit. He was day 22. So 22 days. Hmm. This series highlights the patients with a mild experience. Although every patient survived to hospital discharge, 75% required ICU admission, and with 2 deaths at least indirectly attributable to melioidosis, the overall case fatality rate was over twice the rate seen in contemporary Australian series of pseudo-Malay infections. So there were other cases, 2021, 2017. Yeah, this is like their study. Where was that? Complications of antimicrobial high dose SME SMX that is recommended as eradication therapy in current Australian guidelines. Meanwhile, others struggle to adhere to the relatively long course of eradication therapy, increasing the risk of life-threatening relapse. Yeah, it's like relapse. That's one thing that is like if you actually read all of the cases, like the people who stop taking it always like returned after like certain amount of time. This series demonstrate the challenges in identifying mycotic aneurysms due to be pseudomalay, although the cases presented in a region where the organism is endemic. Melioidosis was usually not included in clinicians' initial differential diagnosis. This can be partly explained by their highly varied presentation. Patients had both acute and chronic presentations and reported a wide range of symptoms. Although fever and abdominal pain were the most frequently described symptoms, they were not present in all cases, and typically the diagnosis of melioidosis was not considered until beef pseudomalay was cultured. It often took even longer, 27 days in one case, to confirm the presence of a mycotic aneurysm. The case series demonstrates the value of early CT imaging of the chest, abdomen, or pelvis in all adults hospitalized with melioidosis in identifying foci, I don't know, of infection which would otherwise be undetected. Case 7, for instance, presented with only non-healing skin ulcers and had negative blood cultures, but CT imaging identified mycotic aneurysm of the abdominal aorta that may not have been suspected. PTCT imaging, available at our center since 2015, also expedited the diagnosis of mycotic aneurysm in 3 of the patients in whom the diagnosis may not otherwise have been considered. Australian authors from the Northern Territory suggested that the diagnosis of mycotic aneurysm due to the use of the Malay may be facilitated if it is considered for any febrile patient 40 years, more than 40 years of age who resides in or has ever visited areas where B. pseudomalay is endemic and who has the following characteristics. Oh my god, oh my god, I'm from the Philippines. Like it's fucking abdominal back tie or chest pain. Yeah, seem fine. Um vertebral, paravertebral, or retroperitoneal collections. Confirm arterial. Okay, I don't have aneurysm. I would be dead if that happened. Or no cause. Maybe I don't know. Or no cause identified after initial investigations. While these four criteria are sensitive for the diagnosis of mycotic aneurysm due to B. pseudomalae, I kind of don't want this song. Sorry. Um, while these four criteria are sensitive for the diagnosis, sorry, my nose. And all eight of the cases in this series satisfied at least one of these criteria. They are far less specific and certainly very few febrile patients who reside in or have okay bye. I've already read that right. Endemic who have abdominal blah blah blah. The same authors have suggested the other important clinical situation in which should be considered is when blood cultures are currently or persistently positive for B. pseudomalae and for which no other cause has been identified. While sustained bacteremia is characteristic of endovascular infection, it was notable that only 2 of the 8 patients in this series had bacteremia documented for 2 of the 8 patients in this series had bacteremia documented for more than 72 hours. Furthermore, there have been 43 or other patients with medeolosis managed at the hospital since 1998 who had bacteremia for more than 72 hours, who rather than having a mycotic aneurysm had other manifestations of the disease, such as a lung abscess or collections in the liver, spleen, or genitourinary tract. Hmm. We do not raise these observations to dismiss the observations of Northern Territory clinicians, but instead to emphasize that even in well-resourced settings, where melidiosis is endemic and where experienced clinicians have access to sophisticated imaging and advanced laboratory support, the diagnosis of mycotic aneurysm due to B. pseudomalae is a challenging one. Detailed clinical assessment, early comprehensive imaging, and thorough microbiological evaluation will increase the likelihood of establishing the diagnosis. A high index of suspicion in the appropriate. Honestly, like I'm thinking about it, but like that's one of the things I was thinking. Like, should I go? Should I be a doctor? But first, I need to support myself. I cannot like support. Like, I cannot go to medical school like without the money first of all, so I have to work first for that. And I feel like I'm not really that good in science and not science, I would say I'm okay, but I need more improvement in science and math, like math related stuff. So yeah, because I do like I don't want to be a nurse, like I said, right? I don't want to be a nurse, but I like the curiosity of things. Like I like ooh, like whenever, like sometimes whenever me and my like my sexual like specialist, I'll call him sexual specialist. But the doctor who puts my stuff in my pellets every year or something. We always talk about like new things that is happening in their own space, because obviously that's another industry of its own, with with its own studies. So that's the beautiful thing about like medical school, I think, or even the academia as a whole. There's like a lot of things, and it's more just about finding the gaps and like collecting your hypotheses, research, and like don't pick any sides, just present the data as it is, because and if you assume wrong, that's fine. Like, I think people are just, yeah, like nothing's wrong with having the wrong assumption sometimes. Like, that's part of things. Like, So weird. As if I'm like, but yeah, the question is what sort of yeah, the pathway. That is what I'm thinking at the moment because I'm into a lot of shit, and I don't know. Like I'm into like I like cybersecurity stuff as well, but yeah, I don't know. It was also notable that all of it's a long choice, just like wet season when almost of the cases of melidiosis are seen in tropical Australia. The actual presenting symptoms will of course be influenced by their site of vascular involvement. The mycotic aneurysm in this and other serious most commonly involve the abdominal aorta, and these patients usually presented with abdominal pain. However, involvement of the thoracic aorta, the femoral artery, renal artery, the splenic artery, even coronary arteries has been reported in cases of melidiosis. So all of these are like individual studies of their own affecting certain parts, basically. Abdominal pain. I think this is around like southeast, like where like the endemic cases. 8 cases in this series were diagnosed during a period when there were 233 cases of culture-confirmed melidiosis at the hospital. The resulting 3.4% prevalence of mycotic aneurysm among patients with a diagnosis of melidiosis is similar to rates reported in the international literature. Fuck, now I'm exhausted. My saliva is running out. I need to like do this one. Give me 1 second. Where have you gone? Why is this song so sad? I feel sad now. Now, with my eyes. It must have been love, but it's over now. It must have been love, but it's over now. In the bedroom. I sorry, wrong lyrics. Okay, let me just drink some water before I continue this shit. I'm not gonna read this other one. I think this is more like yeah, it's more like the 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 map, basically the mapping. And they built the website as well, which is really nice. And as you can see, it's possible that climate change may come in play because once the environment starts changing, it may like you know we're gonna die. Basically, we're gonna die. I'm kidding. No, I'm not. I'm kidding. I'm kidding. But yeah, be careful, everyone. Oh, why did I quit that? You know what? Let's just quit them all. I don't want my computer to lag. Mm. Oh shit! I almost showed my fucking like passwords again. No, I was supposed to look for the history. Never mind. Let's not read that. I'm done. I'm done reading that shit. I mean, I'm not saying it's shit, but let's go to this one because I was looking at this one. But it's over now. I'm not sure now. I'm thinking about it. Nah, I don't think I've ever used like yeah. I've been only using yeah. I've been like JavaScript. I've been sticking to JavaScript, NPM or for Node or NPX or apache get apache app get apache get. Sorry, I changed the lyrics. Sorry. Credits, Rose. Sorry, please don't sue me. I love you. Bruno Mars, I love. Woo, Philippines number one. Anyway, what am I gonna do? Tell me what to do on stream. Suggest. Maybe I should watch the movie you're talking about. Should I? Should I talk about it? Should we watch it? Oh wait, actually let me do my Duolingo first because I forgot to do my Duolingo. How you love me? She's so lovely. But wait, am I allowed to show it here? I'm not allowed to show it. Okay, how about I do this? I have an idea. But I'm not gonna like, you have to like time it up with me. You know, time it up, time it up, time it up. Yeah, tummy up, tummy up. Um, hmm, let me see. How about this? Yeah, I will. Like that. Would that work? I'm lazy to. Do I just add a blur then or? Hmm. There. Would that work? I hope that works. And then we could just put something on the background, right? Right? Does that work? Okay, there you go. Mm. Yeah, I was thinking just showing you the time thing because it's on stand, right? Shiva. What's the title again? So is it a good okay or not? What movie is it? Okay, about fiction. Yeah. Isn't she on that movie as well? Yeah, Uma Thurman. She's on that movie as well. Like that movie about the movie about you know? No? Like she's on the Kill Bill. I think she's on the Kill Bill as well. I think she's the one on Kill Bill, right? No? Oh yeah, I thought so. Yeah, I thought so. Like I was thinking about it. Like, yeah. Like, yeah, she is the one. Yeah, I like her. I like her. Okay, I guess I'm gonna watch it. Cause you made me watch. I'm wondering though if this is okay, like watching it like this. I wonder if my thing will block it as well. Maybe they will block it because I'm broadcasting, right? Like you're caught. Oh, oh, right. Okay. Wait, give me a second. Oh my God, I'm so loud. What the hell? Let me like make myself a little quiet. Should I make my face that how big? How big do you want my face? Hmm? This big, this big, that big, that big, that big. Hmm? Which one? Okay. At least you can see the time. Do you see that? Is that clear? Is that clear or did I need to make it bigger? Hmm? That better? Oh, wait. Oh, 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 that worked. That would work. Why am I turning off my music? How am I how are you? I haven't seen you for a while. How are you doing, lovely? How are you doing, my love? Um, why do I stop letting you speak? I'm not like you can't really hear like they can't really. Okay, fair. Okay, fine, fine. I'll put some atmosphere music. How about that? Like like that. Is that okay? Okay, fine. A big guy doesn't want me to put music on. Oh, anyway, we're do also Elementalists. We're watching hmm, yeah. Take it one day at a time, my love. It will. The world turns around. It's a circle. Well, a semicircle. I don't know. Okay, they're saying it's not a perfect round, but it is. Sending you my love and hugs. Do you see? Do you want to watch? We could watch Pulp Fiction. I mean, big guy suggesting me to watch Pulp Fiction, so because I haven't seen Pulp Fiction. Like we were talking about like people who likes feet, and yeah, it just came up. So yeah, do you like feet? Tell me, are you into feet? Okay, no judgment, no judgment. You're into feet. Like we can all love feet sometimes, you know. Like I like cuddling with feet. Do you guys like cuddling with feet? Hmm? I like cuddling with feet. Yeah, exactly. See, exactly. You're correct. Yeah, like how am I without without my feet? How am I gonna grind? You know. Wait, that's the leg, right? Leg. No, actually. Wow. Okay. Okay, big guy. You have a big feet, of course. No surprise there. No surprise. No surprise. Oh, also it says it has drug use. Should I should I put you know, like some sort of like, you know, should I put a tag or something? What do you think? Like should we say no drugs kids? Don't use drugs children. Drugs good. Drugs good. I mean medical. Medical. Okay. Let me like just set it up. Mm, um mature sexual violence and gore. My favorite. Wait, I wanna hide. I wanna take a hoot. I wanna take a hoot for myself before I continue watching this. Oh, you know what? You know what? Oh no, actually, no. Let's play because I've already seen that this bit, right? I've already wait. Let me actually up my volume for a second. Oh, that's true. I mean, yeah, still, we should clarify this movie is not for kids. So if you have a child or you're babysitting a kid, well, get the fuck out of here. Because you must not be watching unless you're on your mobile. Okay? That's different. If you're on your mobile and your kid is watching, like, um, what's a kid thing? I forgot a kid's show. What's a kid show? What's a good kid show? I could, yeah, never mind. Let's just play it, okay? I'm just gonna hide for a second because I wanna, like, you know. SpongeBob? How is that? What the? What? Also, I played it already. I'm not sure. Oh, it disappears. Unfortunately, it disappears. So do you see that? I'm already there. I'll put this up. Sounds like me. Cool. But the little girl! Where's the little girl? I want the little girl. Ew, yuck, that sounds weird. No, I hope the little girl is safe. Oh, he knows the person. That's evil because you know the person. You're not expecting them to have millions of dollars in their pocket while eating breakfast. This sounds like me when. Oh my god, sorry, did I just pause it? Oh my god, I just destroyed my syncing, did I? Oh my god, I'm so sorry, big guy. Did I just destroy the syncing on your thing? Sorry! I'm just saying, they sound like me when I'm solving something, when I'm stoned. Okay, I'm gonna play it again. Sorry! Sorry! Woo-hoo! Yoo-hoo! Yoo-hoo! That's my sort of kiss. That's my sort of kiss. Like, I don't like the kiss that it's like, because some people I see their tongues when they're kissing. I'm like, Because I think about like, the germs. That's all. Like you have unique germs within your mouth and your partner has unique germs. So unless you guys have mush together already. Okay, I'll shut up. Sorry, I can play it now. I'll play it. Okay. Like riding a horse. I'm riding a horse. Or a motorcycle. Or your body. Just kidding. I have a feeling they will YouTube will still I think you should make a compilation of these people, like whoever's watching like us the same movie, and then put them all together in like a collage or something, and then they'd be watching the movie at the same. They would look like several people watching the movie. Oh, that would be Uncanny Valley version 2.0. Well, maybe 5 version 5 actually. Oh, I didn't know Bruce Willis is on it. I didn't know. Let me do my Duolingo really quick while it's doing this one. Oh, fudge. Pizza. This cake is tasty cakey. I remember this bit. I remember. Oh my god, you just Oh my god, that's probably where I got it from. Oh, murder. That's Dodge. Foot massage. Who wants to give me a foot massage? Okay, no comment. Thank you. No, 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 you know. Who's the director again? Feticino? Something? What hole is he talking about? Oh my god, I gave myself a foot massage a few nights ago. I told you guys about that. Like, it was a good foot massage for my feet. I had to do a baby pose though. Apparently, he used to be really attractive. Like in with people, but I don't know. I don't really find the. Maybe I'm just like weird that way. Huh? That's is that supposed to be something you give? I don't know. I don't like feet, so I don't know. I don't like my feet. I don't like his feet. I don't like any feet. I'm okay with the sole, like this bit, like the bit stuff, but like in terms of like no, I never like yeah. Well, when we were first together, he would eat my feet. Yeah, I do rub. That's what I like. I like rubbing my feet with his, especially when it's it's like a warm. It's like a warmer feet. So look, I have the big PPO. Okay, bye bye. Wow, they were talking all this time. I bet the girl could hear them on the other side. Like these bitches are loud. Like you don't have to show me that you're actually here, you know? Like what the hell? Ooh, they're gonna kill them. I think they're gonna die. They're gonna die, they're gonna die. I'm It's the big kahuna. Oh my god, hamburgers for breakfast. Disgusting. Oh, I didn't know big kahuna. That's an mmm. Just like that looks like Macca's. That looks like Macca's. I bet that's Macca's with Wendy's on it. He wants a foot massage. You gotta give him a foot massage. Is foot massage supposed to be sexual? That's not sexual, no? Like, you guys are such a. Exactly, you gotta be good at doing the massage too. That's why I was giving myself a massage because, like, oh my god, my feet. I feel like I bought the wrong shoes. No, you can drink some water. Drink some water. So they're showing dominance in this scene, like in this bit, because as you can see, it seems like they're all scared of him. Both of them. Oh my god. Sequence. Ow! God damn. Is it drugs? I couldn't remember this scene. I think I remember seeing this. I remember that they started shooting or something. Like it's fragmented in my head. It has to like extract. I sus. The other is this. Ooh, what is that? Ooh. Yeah, I think that's yeah. I mean, yeah, it's a way. It's a way of like. That's true. It's a way of making you getting you confused, so that you can watch it again. Oh, sit down, white man. That's what he said. Shocked me. English, English, no English. And then bye bye. Okay, I think this part I haven't seen. I don't remember this part. He doesn't look like Bruce Willis. Oh yeah, it is. Okay, it looks like Bruce Willis now. I was wondering for a second, who the fuck is this? He's like, he looks like that dude, the other dude that looks like. Yeah, I don't know. Maybe I'm just being weird. Ah, he's a boxer. I see. I like the audio. I like the music. That was, ah, so corruption. Oh, why does he have a bandage though? Fried my ass. Let's see pride. Once I show my nudes. Hmm? How about that? Hmm? Once I start strip teasing. Hmm? 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 And then his ass didn't go down. GGA down in there. Who's Mia? Who's Mia? I don't know who Mia is. Do you know Mia? Hmm? You know Mia? Hmm? Hmm? You know Mia? Hmm? You know Mia? Hmm? Uh, uh, so it's all for Tarantino. Ay! All about the feet. All about the feet. Ay, ay, ay. Keep saying the N word. I just feel like I feel so innocent. Why is it suddenly about penis? What? That's what the hell? Why do we need to know that? Oh, he's the dude. Yeah. This is the guy that got the foot massage. Oh, I was gonna say like what? This is the guy that got the foot massage. The guy that got the foot massage. I was gonna say. Yeah, I'm gonna continue. Mm. So it's the guy with the band name. Fair, fair, fair. I mean, it does look like he has a lot of money. Also, I'm pausing it here because I need to pee. What the heck? I'm back. Sorry. I just need to I'm gonna disappear from the screen for a second. Just because I'm doing something secret. Should I continue it? Yeah, I should. I could hear it. I don't need to like watch it. Like, okay, you know what? I could do this. So I might as well do that. That way I could talk and hide and, is it coming back? I don't, is it coming back? What do you guys think? Is it coming back? I was just thinking about balloon. Oh, that's the why. Whoopee, whoopee, whoopee. What 420? Well, where did it come from? Oh, you don't have that 420. Ooh, 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 ooh. Okay, bye. Which one is it from? Oh, are you saying you want me to make one? Gosh. Look at you. You're using me as a service here, big guy. Like a free maker of gifts. Oh, emotes. I'm kidding. Oh, what is? Oh, no, what are they? Oh, they're high. Yeah, vroom vroom, vroom 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 vroom. Oh my god! You know, this scene is very similar to that particular scene is very similar to what movie was that about the movie about drugs? Like it's different kinds of drugs. Like it used that specific soundtrack. Like it kept using that specific soundtrack. They have the same way of interpolating, like expressing what like the feeling about drugs, like the ooh, or like hyper, upper, down, lower. It's actually I can see that they're using like I can see that they're using I think they're using some sort of projector or something. Okay, I'm gonna do my thing now. Ibis down. There you go. There's the time. Damn. That's a nice house. What is the memes? What is the memes? What is meme? Oh, I don't know what that means. Oh my god. I'm kidding, I know. Ish. Gosh, big guy. You don't have gosh. Sarcasm. Have you heard of sarcasm, big guy? Gosh. Gosh. You guys made that thing. Oh, is she like scared or something? What push the button? No, I don't. I don't get it. What's the joke? Where is it? Where? I don't see anything. My God, drugs again. Ay, ay, ay. Snort, snort. Oink, oink. Because they snort, you know. Oh my God. Of course you're gonna see the feet. Of course you're gonna you're gonna show the yeah, Uma. She's so different here. She's so different here compared to like asshole. Don't be an asshole. Also, don't show other feet without I hope she got paid a lot of money for that. No, that's his signature. I'm telling you. He loves showing feet, especially beautiful girls. She loves showing the feet of beautiful girls. Like, oh my God. Now he's making those sort of things expensive. So that sucks for the rest, you know? That sucks for the rest obsessed with feet. How are they gonna survive? Oh my God, oh my God. I have a shirt like that. And yeah, I don't know if is it required? Are you required to like be part of the whatever they're doing? Because I wouldn't mind. Vanilla. Oh my God! Peggy Sue. Apparently, Peggy Sue is a politician, a federal politician who likes getting pegged. I don't know who that is. Just search it on Google. Oh no, are they are they gonna fall with each other? Duh. Whatever. Is she talking about the other one? Cause yeah, I think how much was that back then? That's a lot. For a shake? No. I'll drink saliva things. Saliva is okay. My saliva, though. Oh my god, that's true. I agree with what she said there. And then she's gonna run away. Oh my god. So crazy. I heard that will make holes in your nose in the long run. Depend, because those are not actually like, some of those are not actually pure, right? Like some of them, it depends on the grade. Like a lot of them are like mixed with chalk. Like whatever drug, what drug is that? The snort? Mm. Coke, yeah, Coke. He's gonna ask for her feet, isn't he? You're gonna ask for the feet again, about the feet. Ah, I know they're gonna talk about the feet. Who's they? I'm all for a foot massage. Oh, you want foot massage? I know. Yes, girl, claim your perspective, girl. Go, girl. You go, girl. Go, girl. Girl. Go. I like her hair. I want to do that hair, but you know, my hair is really nice. Ooh, they're gonna be selected as the copy. Ooh. Yes, girl. Yes, girl. Get that trophy. Get that trophy, girl. Wait. Wow, he's gonna take his shoes. Ah, what is he gonna do? Is that how you guys used to dance, big guy? Is that how you guys used to dance? I mean, I wouldn't mind that. I like that. It's easy. Of course, they're gonna show the feet. Maybe I am obsessed with feet, but in a different way. I'm obnoxiously obsessed with feet. Like, ooh, anything feet. I don't know. I think I have a feet phobia. Oh, what happened? What happened? Allah, it's already okay. Allah, 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 they're dancing like that. Allah, Allah, Allah. I mean, they're just friends. Allah, I hope they don't do anything crazy. Sorry, I'm checking shit on my laptop as well. That's me sometimes. That's me when I'm listening to music alone, especially to Brat. Bump it up, bump it up. Oh, it's just saying that. How many drugs did she take? Oh my god, that is. Why is he having? Good idea. Good idea. Right. I heard some people get the hole. Like there's holes. I'm just being dramatic, sorry. I love being dramatic. What was it, you reckon? What do you think was that? Was that the one that he was supposed to use to like kill someone or something? That's fun. Mm. Please, please, please. That's funny. Do guys care about marriage really? Like do guys care about getting married? Because like I know that girls do. Like that is the thing that makes the whole multi-million dollar industry, probably billion by now. That sounds. Hospital, you bitch. That's why you're supposed to be regulated. Business, business. Stupid motherfucker. That's been recorded before. Oh my god. Don't do drugs. Don't sell drugs. Don't listen to me either. Allah, you're gonna die. You're gonna die. Allah. What she mean? What she mean? A black magic marker. Now he's a doctor. Now he's a doctor. What I mean, they are kind of doctors, like doctor workshop, doctor workshop, like Iron Man. You know, fuck Iron Man. By the way, in Rivals, that was fast. That was fast. Oh wow! Thank the doctors for this sort of drugs. Eh? I am okay. I'm about. Oh my god, she looks crazy. Fuck. When have I told you that I used to get bitten by I used to get like I was bit by a dog back then. So the drugs that they use for like the anti-rabies, because it depends on the length of time that like it depends on which part of the body you got bitten at before it actually like gets to your head, like the brain, and that's when it starts getting fatal. So yeah, I got bitten here. We're not sure. That's the thing. We didn't know because they killed it right away. They killed the dog, unfortunately. But yeah, I was like four or something back then. And we were supposed to swim. Like we were supposed to swim somewhere, and I was wearing some red. It was like a red suit or something. And yeah, I remember it. I was really small then, and the dog wasn't that tall, but it can yeah. I fell when he jumped or she, I don't know. But yeah, just attacked me like that. And then apparently he almost, I don't know, the dog almost bit me in the neck. So if he bit me in the neck, that would have been fatal. But yeah, like you said, I don't know if the dog had rabies because like I said, they just didn't want to like care and all that. But yeah, speaking of the needles, they were like thick. So I fucking remember that, like I remember, and it was multiple needles too. They don't just, it wasn't just one needle. Because sometimes that would like it would reject basically, and they were really thick medicine, thick thick vials. I mean, like they have to like use the thick. Mm. Yeah. So I kind of get scared. And now that I'm talking about it, yeah. The thickest one I've ever gotten a shot from was like the hormones, I'd say. Because yeah, those are really thick ones. You'd have to put them in your buttock. Intramuscular ones. That's what they're called. They look so exhausted. That's fun in it. Silence. Yeah. I love silence. But at least she's alive, you know. Also, did you see the timestamp? Awkward. Yeah. Yeah, that's crazy. Yeah, that was painful. Painful. When I had it the first time I had it here. But yeah, I was like, no, fuck that shit. That scares me. I'd rather get fucking I don't mind that bit. Also, I saw like I got this mark here. I don't know where that came from. What's the joke? I wanna hear the joke. Mm-hmm. Catch catch up later. Catch up later. Like that. He did take care of her after all. That was sweet. Heart. Oh my god. Oh my did they just fucking do an Asian fucking as the part of the Asian committee? Oh my god, and it's America. Ah, America, America. I mean, how's your experience? Did you experience that? Did you see those sort of shit in your television in the United States? Cause yeah. Oh, there's that. Oh, daddy is like, hey, who are you? Who are you? Hey, who is he? Is he that you mean the sperm donor? That's what you mean. The sperm donor. That's the word. I think that's what they're trying to say here. The sperm donor. So yeah, I kind of understand now why this became like it became like a thing. Like people talk about it to this day, like they're laughing with the milk and all that shit. But yeah, apparently that was common back then. I think there was like that whole idea that you must fuck, 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 and populate, populate, ooh, ooh, populate, populate, ooh, ooh, ooh. Oh, sorry. Okay, I was sorry. Okay, fine. I'm gonna play it. Fine. Gosh. Don't tell me this becomes Miss Saigon. Just kidding. Sorry. I'll shut up. What is it, Papa? What is it, Papa? Aw. Oh. Sorry, I gotta cut the nose out of my like itchy. Rip. Oh my god, that's him. Sorry, I'm listening to his story. Okay, by the way. Oh. What? 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 I didn't expect that. I thought he would wow, that's crazy. He gave this fucking watch full of He put this ass. Is that real? Like, oh wow, I don't know if he was like, was he delusional or something or what? But wow, yeah, that's what I'm saying. Oh, now Missy wants to be part of the party. Oh my god, let me show. Come on. Oh my god, baby girl. I know you want to see it. I know you want to see us talk, and I know you want to chill. You want to say? Would you accept the ass watch though? Would you accept the ass watch though? Would you? Press one. If you don't, would you? Would you? Would you get the watch? Press one for yes. Press two for no. Guys, get a chance to win a better. I don't know what I'm saying, honestly. I'm just like saying shit out of my mouth. So this is the boxing box the day that he's gonna box the dude. So I'm just pulling Andy's. I don't know why. Is it worth it though? How much did he give him? Oh, no, I think they beat him, right? I think I know what happened in this bit. I think I know what happened. What did they do? What did he run away? Did they run away? Uh yeah, so basically he won and yeah. They're gonna like Oi, poor boy. Poor baby boy. Poor baby boy. Poor baby boy. Mm, mm. He mad. He mad. Rar. Oof. Wait, is this the guy that said, surprise, motherfucker? The one that says that? Like, surprise, motherfucker. Surprise, motherfucker. And then everyone just started, like, making up their own versions. Like, why a motherfucker? Why a motherfucker? Because he sounds like it. He sounds like it. Where are they going? Where are they going? What the fuck is this girl talking about? What other what other boxing men? Sorry, I'm adjusting my settings on my computer. Rar. I thought that was him on the crying bit. Like I thought that was him on the crying bit. Like I should have I thought that was him. Oh my god, my fucking audio is fucking I'm so loud. I should shut up. Yeah? Should shut we'll just shut up. I like the creativity they did behind the whole driving bits. Do I have like Latina? Do I look Latina, guys? Do I look like Latina? Ooh, Latina, Mexicano. Latina, rar. Or do I look more like Asian? Asian or Latina? Did he kill him? Did he kill him? Ah, so you can actually call, you can actually tell, I see. Because I had some people ask me like there was one time like I was in Boracay, I think. Like foreign, foreigner. No, Pinoy, Pinoy. Pinoy. I had to actually talk in Tagalog so that they could like, oh. But yeah, I'm just wondering. Hey, goddamn right. So he's trying to escape. They're trying to escape because they're going after him, right? Well, I love Esmeralda. She's working in a male dominated workforce. Yes, Esmeralda. Let's go, Esmeralda. Woohoo, woohoo. Kill the man, kill the. Oh, sorry, sorry, sorry. That was too much. That was too much. I'm kidding. I'm sorry. I'm kidding. I'm just being satire. Satire. Have you heard of that? You gotta search it. Search satire, and you don't use Chat GPT. Use use. What's another Nah, actually, never mind. I don't want to think about it. Everything is almost made with Chat GPT these days. Or GPT, sorry, at least. Spoon. Oh, like a cuddle. Oh my god, that's sometimes to me. I like the stink, but only one stink. Only one stink. Wait, what is a pot belly? Let me search that. Fucking what is the pot? I thought that was a dog. Is pot belly a dog? Yeah, I thought pot belly is a dog. What the hell? You have a pot belly, Missy Boo. Um. Oh, okay. Maybe I should put slang. Ah. I mean, to think about it, like now that I'm thinking about it, yeah, actually, let me think about it. Hmm. Okay, that's fair. That's fair. I see what this girl means now. I'm thinking about it, like, yeah, I guess it is warm, like wanting season and after sunny day, I want a big boy, I want a big boy, I want a big boy. You know that song? You don't? You gotta listen. You gotta listen. I have a pot belly. Hello. Shit! Oh shit! What? Is that true? Is that true? Like a pot belly for a woman is. I don't know. Is that true? Boys, men, boys slash men slash, like I don't know. I mean, to think about, there are people who bulk and then like shred depending on like the season, I guess. But yeah, I'm just wondering. Like, I guess it depends on the person, right? I shouldn't like think about it like that, but would be nice to share some perspective. So a pregnant woman. This is looking like a. I feel like I should disappear here because this doesn't feel like. I feel like I should like hide. I feel weird watching this with some. Oh, because they're being chased. Yep. 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 So you guys should fuck before it all ends. Oh my god, you keep talking, just do it and get it all done. Gosh. Oh my god, this sounds like me. She sounds like me sometimes, like when you're doing it. Like, do you like that? Do you really like me? Am I pretty? Am I actually pretty? I can suddenly say that in the middle of doing kinky stuff. Ha 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 ha. That's that's sweet. Ah, okay. So this is the guys. This is the director's way of saying that love is like, okay. So what turns a girl on? Like things like that. Okay, okay, okay. Okay, okay. I don't know though, cause yeah. I guess. Yeah, I guess. I don't know. I didn't know honestly. Like I don't know. Oh my god, what a smart girly. Yes, get it first. Ah, big guy, what did you make me watch? Big guy, what is this? Big guy, I don't feel okay. I feel like this is like this isn't like, oh gosh, big guy, big guy. What is this you're showing me? I don't know all this shit. Oh my god, she keeps saying it. She keeps saying the oral, oral, oral. Saying oral, oral, oral. Stop. Oh, that's a lot of naming. That's a lot of baby names. Why don't you stick to one? Stick to one for a few. Sorry, I'm glad they didn't like show too much of the nasty stuff. 'Cause Wait, ¿Dónde está dónde super did he say mall? ¿Dónde está tienda? Tienda un grande. Ah, zapateria. Zapateria. Oh my God. Oh, I know. I kind of know Spanish now. Hola, ¿cómo estás? Muy. Soy. I got the fucking. Oh my God. Sorry. I fucking overestimated myself, like the CEOs these days. Sorry. That's what they said. Overcompensate promises, underperform. Mm, yes. Ora, 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 ora. To actually think about it, we have like like Spanish, like Latin. Is it Latin or I'm not sure if it's Latin. But yeah, basically yeah, we have similarities in our language that was absorbed after after being conquered by the Spaniards. We've been conquered for like a long time. Like it was 300 years more than it took a really long time, and I think it got to the point where we just embraced the language, it became a part of us. And obviously because like everything was like dominated by the Spaniards, it became like a basically oh my God, maybe I should do a history in should I do history? Do you like history, big guy? Do you like history stuff? Or are you bored at history stuff? Is Butch alive? Oh, he's alive. Never mind. Oh, she's still brushing? That's a long time to brush. Oh. Now it's their art. I see. I wonder why this is showing up though. How are they gonna do that when they're being hunted? That's weird. Oh no. Did you check your ass? Did you check your ass if it's in your ass? Allah. Allah is so angry. Allah, it looks like he's gonna become a new person again. He looks like it's about. He looks like it's about to laugh. I don't know. Is he looks like it's about to laugh or like I don't know. Ah, it's fucking funny to think about it. I'm sorry. I'm sorry. But I get like I think it's like it's about the sentimental stuff and all that stuff. I think that's what they're trying to point out here. It's just really funny that he chose to include that they had to put it inside the ass of I don't know what is the grandfather or yeah. Oh my god, this is me. Like I don't trust myself. Like I say I don't trust myself because I don't. Like I say I do, but like, you know, he's fucking blaming her instead of himself for not checking where it is. That's what's happening here. Instead of like blaming himself like oh shit, I forgot it. I mean, I don't unfortunately at this point, I don't think he could do anything, you know. Think about it. Like I don't think he could do anything at this point because if he comes back, they're gonna kill him or something. So yeah, bye bye watch. There's something they do in art, like whenever you make an artwork, it's like birth. They say it's like birthing a baby. I mean, to think about it, like usually, like one like a mother, when she takes care of her child for the first 18 years, they usually like go to college. I mean, at least in the United States, or like find a job, move out, you know, those sort of things. And yeah, it becomes lonely. It's the same thing with art. Like you make something at the same time, like an artist should get used to the idea of also like letting go of something that was there, you know. It used to be there and it's time to let it go and build a new one. You need to get used to that idea. But yeah, do you believe it's the same idea with people as well? I've done personally. Like I'm not sure myself with people, but yeah, with like sentimental stuff, I'd say that that's the case. But of course, that's just my perspective. Okay, like it doesn't have to be right. Well, you should have kept it. You should have had it with you all the time if it was really that sentimental to you. Or you could have done something beforehand if it was that sentimental to you. Like it just shows how I guess it's a character thing. It's or I don't know, maybe the director or whoever thought of this didn't think about the story behind the dude, but you know, during like I'd say like in the context of running away, like it's possible you can miss a few things, you know. That's why I like heists and all that, like they always plan. There's a reason why they plan. Even in a lot of things requires planning. Like as far like engineers plan to before they build a civil project or something that helps society. You know, yada yada yada. Because it's going back. Oh my god. Oh my god. Oh my god. Higa na, bye-bye. Oh my god. What if she did get it? What if she did get it? I have a feeling she did get the watch. I have a feeling she did get the watch. And he's just like being a piece of shit. Like instead of fucking giving it a think, he's fucking using his emotions, getting angry. Instead of, oh wait, give me a second. Let me give this a little bit of a think. Ay! I'm sorry, I just know some people. I'm getting angry thinking about it. Like, oh my god, I shouldn't think about it at all. But here I am. I'm angry. I'm angry, but not that angry. Not that angry. I don't care honestly. But yeah, yeah. When people are like that, I just refuse to deal with them. Like boundary, boundary activate. Because I ain't dealing with that shit. Not when I got used to it a lot of times. Like not now. Not ever. Am I ranting? Sorry, I sound like I'm ranting. But yeah, it's honestly it's pretty like I don't want to talk about it anymore. I'm just gonna shut up. Oh, so this is this is so familiar with the GTA thing. Like usually there'd be a lot of people here that you'd have to kill them and they're like in a gang or something. Are they gonna be there? Are they gonna be there? Are they gonna be there? Ay! Okay, I'm gonna look away. I'm gonna look away. I think they're in the bed. Are they in the bed? La 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 la. Alas, stupid. Oh, that's the watch. So it's her fault after all. And then someone's there. Ah! Oh my god, you stupid motherfucker. Oh my god. Oh my god. Do you do that? That is way too thin to fucking cook. Run away, 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 run away. Ah! Sorry, 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 baby. Did I scare you, baby? Okay, I think that buzzed like something in my head. I recall this bit. I recall this scene. I recall this particular scene. I think I've watched it, but I kind of forgot it or something. Because yeah, I can remember some parts of it. Bye bye. Do you remember each part of this movie when you watched it? Because there are movies out there that I've never like. Yeah, I couldn't remember probably until I watch again. Oh my god. Yeah, so you already have it you already have it all, not fragmented, but you have it all like, oh, I remember this bit. Oh, I remember this bit. But it's giving the same vibes as Once Upon a Time in Hollywood. Like from this shot alone, that's something he does in the Hollywood thing as well. He shows that bit. Except obviously the context is a little different. I kind of see the same elements. I don't know. Argue if I'm wrong, please. But don't argue with malicious intent. Like not don't be aggressive too much. Logical arguments are allowed. Oh, I thought I heard the dog. And then it explode. I think something will happen. Drive, bitch! All for a watch that went inside their ass. S S S S S S S S S S. Ah, it's alive! It's alive! Ala, ratatatata. So they're gonna be fighting. Okay. See, I knew this bit. This is like they're gonna fight. Wow, they look like NPCs. Run, bitch, run! That's why you look first before you drive. You're supposed to look on the left, on the right, on behind. That. Oh, oh, big boy. What's a big boy? Hmm? Are you a big boy? Hold it, right? I'm making it my best. Toss the women. Toss the women. He said the N word. So many N words. Did they get both? Did the both of them get kidnapped? So they get 911. That's too long for 911. That doesn't feel like now 911. Oh. Oh, so he's the spider. He's the spider, guys. Just for context. He's the spider. Speaking of spiders, apparently they're like doctors are using like spiders as like I don't know if it's a specific spider or like a spider like spiders in general, but apparently they're trying like when you put air in a like I'm not sure like it was like like that like if it's dead like that and then it does that and then you press like air into it it starts like crawling and because of how like specific their feet are like and all that basically it helps with doctors might be able to like surgeons in particular might be able to like use it basically to assist with really really tiny like sort of surgeries. I'm not sure if it's accurate. I gotta check it out. Hmm. I was just being informational. That's not yapping. I feel like yapping is like talking about your life and all that stuff. I don't have anything interesting about my life going on. I mean, I got like, but yeah. I feel like I like talking about interesting, you know, tech stuff and all that. Also, have I been lagging? I'm seeing that I'm lagging a lot. Maybe I should like close a few windows actually. It's not really good. Let me actually do that. Sorry. Also, why am I sharing my it's so weird. I shouldn't be sharing that. It's probably why. Yeah. Yeah, it's sharing my thing without like me knowing. They're using a gag ball. Oh, that's a joke. That's a joke. Bye. Who's Zed? All I know is Z is the last letter here. Like Z. Like XYZ. That's what they say here. ANZ. Why? Oh, lie. Lie. Who's gonna be the bigger daddy? Who's gonna be the bigger daddy? Ah, that is Z. You gonna share more? That's what he said. Why is he white? I'm kidding. Oh shit, I sound racist. I'm sorry. Fuck, I sound racist. I'm racist, am I? Fuck, call me out, big guy. I know I'm racist. I didn't know that. I'm a pee. 1 second. That was what I was. Pee. I'm a pee. I'm a pee. I'm a Are you a big guy? Are you a promoter for Velvet? You're promoting Velvet, huh? You're promoting Velvet, huh? You promoting Velvet, huh? Why you promoting Velvet? I'm kidding. You know what? I'm being a bit. I'm sorry. I don't know. I'm being a bitch, but I am a bitch. I know. Don't worry. I know that. Let's play this shit. She should add a poopy emote. I bet she has a. Does she have a lot of emotes? I don't have a lot of like those things. I think you need to like reach the goals and all that. I'm not really like fuss about the goal and all that shit. That's why I was just showing like random goals here and there. Maybe I should set it back up, eh? Should I set it up again? Hello, what are they doing? Oh my god, they're gonna do something nasty, I know. They're gonna use the feet for the feet massage. For the feet massage. Ah, ooh, what is that? Oh my gosh. Where are we? Where is this shit? Oh, here they're gonna which one to suck? Like the which toes to suck? Oh my god, it is so. Of course, it's gonna pick the black one. They always pick the black one. Of course, they pick the black one all the time. All the time, it's gonna be the black one all the time. Like, I represent them. Just kidding. I'm not representing them. I'm just kidding. No, just that was just a joke. Sorry, 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 sorry. I was just trying to make something up, but I was just joking. I'm sorry. I'm sorry. Please forgive me. Don't fucking sue me. Oh my god, I'm so sorry. Of of see, I knew it. I knew it. Of course it is. Of course it is. Ah! Oh my god. Oh my god. It's oh my god. Like gosh, it's always them. When is it gonna be the white guy this time? Like pick the white guy. Oh my god. What is this? What is this? What 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 XXX is this big guy? No wonder I don't remember it. My brain probably chose to forget it. Like my brain was like, what the fuck is this shit? Delete, delete, delete. Erase memory, erase memory. What are they gonna do there? What are they doing in there? What are they doing in there? Do you know what they're doing in there? Any of you have an idea? I don't know. I don't know what they're doing in there, honestly. Yeah. Ew. Allah, feel bad for your friend. Kill the other bitch. Kill the other bitch. I think he goes back and kill them with the shotgun. I think. See, oh, Allah, look at all the shit. So 1 to 7. What does that mean? I don't know what that means. But I see the flags and all that. It's showing a lot of like, America, America, America. Ooh, America number one, America, America. Ooh, number one, America. Something like that. You know? Like the clan back then that like hates like specific types of people. Yeah, that's the sort of like vibe. I don't know if it's because of the flags or the whole thing. But yeah, that's what it's showing to me. Like I feel like that the like to think about it, like that further clarifies why they chose the black guy because they wanna like no the flag. See the flag next to the things, next to the plates and all that. Okay, fine. I'm wrong. I'm sorry. I think you're. I'm just like. I'm just like. It's just a hunch. But if I'm wrong, fair enough. That's just a. Yeah. Oh. Oh, there. Use the chainsaw. Use the chainsaw. Ay, why don't you use the chainsaw? Why? The bat? Why is the bat? No, just the chainsaw. Yes, pick the chainsaw. Yes, yes. Oh, he's seeing it. Oh, oh. You know, he shows like he uses the sword as like the sword is a thing as well. Like in that movie, the Kill Bill thing. I think the first part was like the sword. It was like talking about the sword, and then the second part was already about her and the guy, the dude that ditched her for another woman. Like where just something you chuck in the bin, like your objects. Yeah, I'm looking at some people. Some people, I'm pretending. I think I know what they're doing to the dude. Kind of feel bad for the dude. Yeah, cut his dick, cut his dick, cut his dick right now. Cut his dick, 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 cut this dick, cut his balls, cut his balls, cut his balls, cut his balls, cut his balls. Ow, I'm exhausted. That exhausted me. I had to jump, you know. I had to do a mini jump, you know, quarter jump. Yeah, pick it up, dead. Oh, he mad. Of course he's gonna be mad. Of course he's gonna be mad. Like, oh my god, like he deserves that. Bang! Bang. That was just one shot though. You should have like fuck him in the ass too. Like you should have fucked him with the ass too. Because like what the fucking bitch. Like you should maybe shove the gun into his ass, you know, like that movie. Like I forgot what movie that was, like, but it was the girl who put that shotgun up his ass. You know, and then do the same thing because they like, ay, what the fucking like sometimes like I just lose my fucking sanity to this sort of like shit. I mean, look, see, I'm getting emotional again. I'm getting emotional. I should breathe. He's never gonna be okay. Like you can see he doesn't like to be fucked in the ass. Like that will show from the muscles. Like if you're a bottom girly, then okay, fine. That's fine because your muscles want it. So your muscles and your I don't know, like whatever your ass is doing there, like I don't give a fuck. But it has muscles on it that contracts, like open, close, a little bit. Obviously that's gonna be close if he doesn't wanna be like fucking like he doesn't wanna be the bottom, right? Like hello. And you're forcing it in there. Ah, what do you mean? I don't have muscles. Yeah, I don't. I have muscles. Oh, look, I have muscles. Allah, uy, Allah, do I not have muscles? Allah, I feel shy now because I always follow those big guys on Twitch, and I say, oh, muscle, muscle. Oh, I want muscles too. I don't have muscles. I don't have muscles. Maybe I don't need muscles, right? The muscles need to carry me. Oh my god, I'm being a bitch. I'm sorry. Shoot his head! Shoot his head! Oh my god, no, don't shoot his head actually. Like, maybe show the thing first. Show the thing off his butt so that when he shoots it, it's gonna be. And then straight to his face. Honestly, that's. Ooh. I just get angry at people who do those sort of. Like, I don't know. Something gets. Something gets to me that gets angry at. Like, I don't know. Like, it just. Well, my head just like. Oh, they're gonna do it too. Good job. Good job. Yep. Yep. Exactly. He likes that. Oh, oh, their piece. Yeah, true. Yeah, fuck that shit. Honestly. Oh my god, it's getting me pissed again. Oh my god, oh my god, oh my god. It's just a movie. It's just a movie, bitch. Stop her. Mm. I didn't know they have rib. That was LA? That was LA? That didn't look like LA? I mean, I guess it's old, that's why. Don't tell me. Oh, he's gonna put him in the thing. He's gonna put him in the thing. How about this dude? I wonder what's gonna happen to that dude because he's like a bystander. You kind of feel bad for the dude. Like he was just trying to be like, he was just trying to feed his own desires. He was just feeding his own desires to be a sub. Like if I were taking care of that sub, I would like take care of him like a dog. Or her like a dog. Like I was like, baby, baby. Oh, I would never do that to you. Oh wow, that's quick. He's already there. That was quick. Oh my god, what's happening? What's happening? They're where are they going? Mm. You gotta pay that Honda back. It's Japanese. Hi, hi. Strong car. She looks like me. She looks like me. Oh my god, this is me sometimes. Oh my god. I don't know if any other girls do this, but like something happens and you just like yeah, you just break down like that. Like especially when you're thinking about a lot of shit. Actually, it just happened yesterday. Like I was thinking about a lot of shit and I was getting to the point of paranoia. Like I was getting paranoid at that point and I'm like fuck, fuck, fuck. I was doing that, and then my partner suddenly, she did that shit on me, and he fucking like I got shocked. Like it actually, I know he was trying to be funny, but like it actually shocks you, like when you're in the middle of. I guess I was like thinking, I was thinking, like I was like, I don't know. Not just a girl's thing. I guess that's a human thing. Is it like does that make sense? I don't know. I'm just gonna like, what do you mean? Yeah. I mean, yeah, I get it. I get now. I get what you mean. You're sweet for saying that. Thank you. Yeah, it did distract me for a second. And it's actually helping. It's actually helping. I don't like it, I feel like I don't want to be a narcissist. I feel like I'm being a narcissist when I think about it. But, yeah, I'll just gonna ignore it, Just do my own thing. Stay grounded and do some hum, hum. Oi, you better you better get him fucking pancakes, whatever pancakes that was. Like they said they want pancakes or something. Sorry, I need to like pick my nose off. What's a chopper? It's chopper. So then it's just a fucking okay, I know what's gonna happen. They're gonna show the story of Zed. So, because there's a lot of time in this thing. I see. That makes sense. So, who is Zed? Because, yeah, they didn't seem to show a lot about Zed. So, if you actually see, there's like three arcs, like one arc, and then the other was interlapping, and then another story interlapping on the other. That's interesting. But let's see. Oh, oh, this is the hallelujah. He should have stayed hidden. Naughty. Naughty. It was a prop. He's a dead. So dumb. It's two of them as well. He should have stayed hidden. Oh my god. Don't mess with people with black suit and tie. Not saying black as in the race. Oh my god. Oh, is it? Let's see. Oh yeah, there is. No, it was already there. Wait, I don't. They don't show it actually. They wouldn't show it. I don't see it anywhere. Oh wait. Oh, see, the bullets were already there. The bullets were already there. Check it again. Check it. Check it. The bullets were there. So it looks like the bullet. It wasn't a real bullet. Like, is it a real? Maybe I'm just yapping. Maybe I'm just yapping to extend the time so it looks like I'm doing something. Oh, sorry. Sorry. I'm tired. He's gonna turn to a priest. I think it's better of a priest. Oh my god, you are stupid. Oh my god, that's a lot of blood too. Oh my god. Wow, they can even. Even. Ah, of course he had to add himself. Of course he had to add himself into the scene. Of course he had to say, of course he had to add himself on the scene. Of course he did that. He had to. To. Just like Selma Hayek and the scene with him and that weird fucking ugh. Like I don't want to think about it. I don't want to think about it. I don't want to think about it anymore. I'm traumatized. I'm traumatized, guys. Okay, I'm gonna play it. Oh my! I don't want to see him. I don't want to look. I don't want to look. I feel. I feel like. Ooh, like whenever I feel like when I see him, I have to hide my feet because I'm kind of scared. But yeah, fortunately, I got socks on. Socks, socks, socks on. I got my socks on. Now you gotta give me your feet. Did he just use the N word? Did he just use the N word? Look, I know that's there are like I guess it depends. I guess it depends. Yeah, I would start to realize that he's probably like that's probably why he added this scene. Now I feel like he's giving an excuse to use the N word. Like just so stupid. But just pretend, just like in the movie, you know. Ay, ay, ay. I was just thinking of a title. I don't know what title to make up of. Why do you like the Hawk 2? Or do you like the Hawk 2? Do you like the Hawk 2 or the Hawk 2? Because the Hawk 2 is a swallow, I think. That's what I'm assuming. So that's like a spin. Hawk 2. Yeah, fair enough. Fair enough, fair enough. A lot of people like both too. How are you, by the way? I hope you're well. Who's Bonnie? Also, I'm watching, sorry. Feel like we're watching Pulp Fiction, but copyright. So, yeah. It's like, oh, okay. He was, uh, yeah. Aw. What time is it? Oh, I think it's, yeah, it's pretty late in the US at the moment. Aw. What time do you usually sleep? Aw, yeah. Oh my God. I haven't, oh my God, I haven't done anything for the, I should go back to the gym again. I might go back tomorrow. I might go to the gym tomorrow. Just to like, I just want to go there twice a week. I just want to go there twice a week. What are you working on? And I hope you sleep well, by the way. I hope I bore you. Like if you want to get bored, watch this. Watch me. I'll bore you. Like I'm the sort of person who will you will get sleepy at. I'm kidding. But yeah, what are you working on if you're there? What are you working out on? Because I want to get my tummy flat. I wish I could get my What? That's crazy. 8 kilometer run? That's insane. Muay Thai, you do. Oh, that's cool. Muay Thai is interesting. I want like that's interesting. It's from Thailand, was it? He's like a Uncle Saul, like Dr. Saul or something in this movie. And yeah, I only do like I only start with like been starting with some running like just incline, jogging and all that. But I'm thinking of doing some what do you call this? Yeah. I mean, do you want to go like professional? That's all. I'm not sure. Where are you at? Like like do they have like starts with a local league, right? Like it's always like local leagues and then you train up from there. Missouri, I see. Yeah, I'm just curious how it is there. Lots of cream, lots of sugar. It's leather though. Some of it is leather. Sports is actually a fun way to do. We're watching Pulp Fiction. It's almost done, I think. It's just a few minutes. 30 minutes. We're almost done. Because yeah, I just don't want to show it for copyright. It has to be covered. So I have to be dictating what happens. Someone drinks a coffee with lots of cream, lots of sugar. Like that. How are you though? How are you, Junie? I hope did you just wake up or were you outside today? Oh, do you guys see the same people over and over? Because yeah, I was just thinking about this a while ago. Like I'm getting delusional. Like why am I seeing the same people? Why am I seeing why am I seeing the same people? Like fucking hell! Like it even made me cry one time. Aw, yeah, Pulp Fiction. Yeah, I don't. Does the title come up on top? Do you see that? Wow. So he's a mechanic. It's a mechanic. Yeah, we were talking about Kill Bill. We were talking about feet. We started with feet and then it went to this Quentin Tarantino dude who loves feet and ate Selma Hayek's feet in a movie somewhere. And I wonder how much that girl got paid. She better got paid 100 billion million zillion dollars. Like it's all yeah, but like feet. Whenever I think of feet, I link it to him already and I get like, oh shit, I should wear some socks. Like honestly, like people laugh at me here because I always wear socks especially at summer. Like people give me socks on Christmas just because yeah, they always see me with socks. Like I rarely never wear like I think at the beach from now on because I watch this movie now. Just nah, nah. But yeah, feet. My feet. What is feet? Yeah, a please would be, yeah. More than one please. A please, please, please. Three pleases. Sabrina Carpenter. Bleach. Oh, is that the anime? Why is the director at the back? Like, what a stalker. The director should be behind the camera and not watching from there. Like, gosh. What game? Ah, Rebirth, Rebirth of Souls. Is that it? Ah, is it good? I mean, that's the thing with Oh no, they yeah, actually, never mind. What is it? What is it about? Is it like PvP? I see. He looks like this old man looks like I I forgot his name. Fuck it. He's famous, that old man. I see. Yeah, I think they also made that Killing Evil Evil Yada Yada game. Like the one where you write the name of the killer or something. I think they did that game as well. Wow, that's a lot of money. Gimme, gimme, gimme. Gimme, gimme. Why is he suddenly giving him money like that? Like it just switched like that. Like what the hell? Yeah, that probably stinks too. Yeah. Ah, oh my God. Speaking of Jesus Christ, like whenever it's 3 o'clock in the Philippines, like almost everything. I mean, not everyone, but almost everything suddenly stops playing. Anything happy, anything like even on the television, like there's something ding, 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 and then you start like they have this whole prayer going on. Like oh shit, like you're having fun, and then all of a sudden you have to like oh shit, we have to pray. It's so weird. It's so weird. Uncanny things. Uncanny things. But that's because we're mostly Christians. I mean, I'm technically a Christian. Think about it. You just did. You just did blow something up. Sorry, I'm like, where's my headphones? They covered it up. I'm dictating it so that you know what's happening. See, no copyright, no copyright. What's next? Oh yeah, true, true, true. Yes. Take them clothes off, boys. Take those clothes off. Oh, yeah, yep, yep. That's a yeah. Actually, I, I I don't remember this bit. I don't remember. I remember watching it, but I don't think it's either I didn't finish it or I didn't watch it because I recall some bits of it. I recall some bits of the movie, but I also like, yeah, I also don't recall. It's weird. It's weird. Like, yeah, it's like I'm. It's fun. Like it's funny. It's funny about the ass. That was funny. I didn't know about the ass. That was my first time knowing that. The bit where they got both kidnapped. That was like I kind of recall that bit. That's why I was saying like I'm not sure if I've watched it or something. Cause yeah, it's coming back. Yeah, honestly, I feel like it is. Like maybe I was yapping like and then like I just forgot it all. Like, but yeah. But yeah. I know. Call me out. Call me out. But I'm seeing it now again. Yeah, I think I need to watch movies multiple times. It's because I'm giving a movie review at the same time. Yes, like them close up. Oh my god, look at John. John is the kind of I don't know about John. John. Why do you look like that? You're so hairy, John. John. What the hell, John? How old was John Travolta in this movie? Like, how old was he? Because yeah, it's looking like it's giving old man vibes. I mean, no offense to old men. Oh my God, big guy, I'm sorry. Oh yeah, that wasn't. Oh yeah, that, woo, big guy, woo, big guy. Old men are hot. Woohoo, woohoo. But yeah, I don't know. It's just a little off. Like it's just a little off for me. Or maybe I'm just being judgmental. Maybe I'm just being judgmental. Yeah, I think I am. I think I am. I'm bad girl, bad girl. How are they gonna shower? Woohoo! Yes. Wash up, wash up. Turn around. Turn around. Show us your ass. Turn around. Show us your ass. Why aren't they showing the ass? I'm kidding. I'm kidding. I don't want to see a fat, fat male ass. No. Wow. It's been a while. Like this guy has been here a long time. Like I think he should be behind the camera, honestly. Like ah. Thank you for letting me know. I wouldn't have known. This is why, because I'm yapping, 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 yapping. I forgot the little details. Okay, thank you for letting me know. Because, yeah, now I don't know what about the shirt. I wasn't like wondering about the shirt a while ago, but now you said it, that explains it. So the shirt was used as a plot device to show like the timeline. Oh, that's the dead guy. I want to see it again. I think I saw his eyes. Wow, that is so spooky. Fuck, that is so spooky. Fuck. Do you guys, is Hollywood amazing? Have you guys been to Hollywood? How's Hollywood? Is Hollywood amazing? You haven't been. There's a lot of Filipinos in LA. Pinoy, Pinoy! Hello po mga Pinoy! Pinoy po ako! That's Tagalog. If someone speaks Tagalog here, I will speak in Tagalog. I just feel bad because I don't want to like leave you guys out of it. Hi, Raquel. Oh my God. Ha. Wait, did she say goodnight, Raquel? Yes, breakfast. What's your favorite breakfast? I know Big Guy's favorite breakfast. Big Guy's favorite breakfast is the three large eggs, three large bacon, three large what waffles? Was it waffles? Did you say waffles? I don't remember it anymore. Sorry. Bagels. Oh, I like bagels. I don't mind eating bagels. I like bagels actually. Now I'll keep it in mind. So am I correct? Three. Yeah. I don't mind just eating like yeah. I don't mind just eating a bread like a bread like as just toast with eggs and bacon. That's it. I'm okay with that. Or I don't mind I kind of want to try avo toast as well. Everyone loves avo toast for some reason. Like I don't get it. What makes it good? But I bet it's gonna be delicious if you add bacon with it, you know. Come to think of it. uh what is miracle? Oh, oh my god. He just said the same thing. Hallelujah. Hallelujah. Pepsi. Wait, wait. I think I know what's gonna happen. It's the two at the beginning. Was it? It's the two at the beginning um who did the you know like put your hands up, and then these two are in that whole like diner because yeah the diner is becoming like a thing. Okay, yeah, I see. I knew. I watched it. I watched it. I promise. I watched the movie. I don't know. I'm like acting like it's my first time realizing. Honestly, I don't mind being a bum because I got a juicy bum. Keep it juicy, juicy. I mean, technically, they don't have a job too, right? By legal terms. Yeah, take a shit. Yes. Poopy health. Take a shit. Wow. Sometimes that's too late. You're dead the moment that happens sometimes. Sometimes you'd be dead already when that happens. Like the clarity moment, like you're gone. Or you're already like, oh shit. It's over. It's over. Oh my god, sorry. I keep it like feel like a fucking like oh my god. I'm so evil. Shut up. Allah, he has a gun. Allah, Allah, don't shoot him, please. Oh, okay, there's a cop. Okay. Oh, he's using okay. What is she read? What is he reading? Modesty Blaze. What is that? Modesty Blaze. Oh, this is so dumb. Even the cell phones. Oh, it's the necklace or the watch. What is he? What is he talking about? Oh, what's in there? Is it a head? Is it a head? I don't know this bit. That was true. That bit was true. Sorry, I'm kidding. I'm kidding. I'm sorry. Oh my god. Oh my god. I'm so sorry. Unload. Unload in my fucking face. You say? Unload in my fucking face. Unload in my face. Bye. Just shoot the dude. Like fucking hell. Get it over with. Oh, this is the gold thing, the diamond thing. What is in it though? Let's see. I'm not sure what is in it. Like honestly, I don't recall. Is it gold? It looks like gold, but it might be a dildo. What is it? Show it. Show it to me. Show it to me. I wanna see. Oh, she crazy. Oh, she doesn't listen. She doesn't listen. What's a funzy? What's a funzy? Let me see. What's a funzy? Late. What? How that doesn't make sense. Ladies God. What? When fingering your partner's ass with your thumb right before. What? What the hell? That sounds weird. The act of hitting a TV show. So is it that one then? Like the fun, like this one, Fonzie, the Fonz. Okay. Happy Days, is it? Fonzie was seen as like he's the cool guy who gets the ladies. Is it something like that? Eat shit. Okay, I get. Thank you so much, big guy, for letting me know because I wasn't sure about the context. Like what's the context of that? Because I'm not American. Correctamundo, mundo. Someone send me something on. Let me actually check. Mm, ah, Same. Oh my god, we're the same. Oh my god, we're the same. When someone is shouting at me or someone is getting aggressive at me, I feel it's not really like me getting angry, it's me getting scared and then realizing, wait, this is out of place. This is out of place. You don't have any right to like raise your voice at me like that for expressing something of opinion. Like how dare you? It's like that girl, it's my opinion. You know? Yeah, yeah, exactly. That's when the motherfucking get pissed. Oh yeah, I got it. Yeah, oh motherfucking get pissed, and then motherfucking won't talk to you anymore. Like get the fuck out of my face, like that. Oh my god. Sorry, I'm not sure what I'm talking about. I'm just gonna shut the fuck up now. Nah, he doesn't. Nah, nah, he doesn't want it. Mm-mm. Nah, no, 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 mm-mm. Yeah. KFC. Yeah, transition. What's in the case? I want to see. What's in the case? What's in the case? What the hell? Wow, he's really good at like keeping everyone calm. I smell good. Oh no, she gotta. Oh, be here. Be there. Be there. Allah, you gotta get her a thing. Bad motherfucker. Bad motherfucker. Bad motherfucker. Bad motherfucker. Bad motherfucker. Bad motherfucker. Sorry, Miss Simu. I was being like, I was just listening to what he was saying. I wasn't talking to you. Yes. Bad motherfucker. Take the money. Take the money. It's yours, you bitch. It's giving it to you. God damn. Like, God damn. He doesn't know math. Like me. Oh, yes. Yes. Thank you so much, Papi. Arigato, Papi. Mm. Oh my god, shut the fuck up, John Travolta. Oh my god. God damn. Just stay on Footloose for a second. What is it? Oh my god, here we go again with the Bible. Oh, that's the same one a while ago. Wait, give me. That's the. Is that the same one a while ago? That sounds like it's just blabbering the same shit over and over. Just so that he could make up time. I don't know. I don't know. Oh, sorry, shit. Amen. Oh, shit. Amen. Amen. Is that what that means? Is that what the Bible means? I don't think so. Oh, bad boy. Oh my god. Bad boy. I'm a kid. He's choosing kindness. That's what's happening. Oh my god, he's actually using his Bible beliefs. Amen. Amen. Good character. Character. And then Oh my god, he should be a priest. He should be a priest. Oh wow, they gotta pay. They gotta pay. Oh, oh, they gotta show they got a big dick. Oh, that was fun. I enjoyed that movie. That was a fun movie. I was like, but okay, so I guess they will never find out what that case is. Like, we'll always ask what's in the case. Like, I feel like that's what's gonna happen here. Like, but seriously, I enjoyed it. I enjoyed it. I was thinking about playing poker today, but I don't know. Like, I'm just like not feeling, yeah, it's like a figure, like it's up to you to like assume what's in the case. The point is the case looks like it has something expensive and like something of value, upon seeing the whole thing. And I think that's a lot, there's a lot of movies that actually show those sort of stuff. Also, I might have to end my stream early today just because yeah, I have some appointments. Like I said, I'm going back to my therapist and I'm looking into like, changing my medication. So I'm gonna try calling them just so that I could just figure it out what's gonna happen. I'm sorry if I'm ending it early. I'll try to stream tomorrow. I'll let you know. It's not a surprise stream, but I'll let you know. Okay. And to whoever's here who came in the app with me, I really appreciate you, Shad, Junie, Elementalist. I see you there. I really appreciate you guys for being here with me. Like, you guys are really sweet. And yeah, I hope you guys are feeling better. I hope you guys are feeling better. And yeah, yeah, don't worry. It's a surprise. Just kidding. Nah, I'll try to be here. I'll try to be here. I'll let you know if I can.